Doctor, we have another question.
Hi, I am Sinsa from Saraswati Vidyanidiketan. I have a doubt. What is sports injury? How common are sports injuries? What type of injuries occur in sports? How are sports injuries diagnosed?
Sports injuries are the injuries which occur to a sports person. It can be either a professional sportsman or even an amateur sportsman or even a common man who is taken to the sports field. It can happen during the sports or it can happen even during the training period. So any injury which happens during sports is called sports injuries. Now there are different type of sports injuries. It can vary from from a small minor cut, abrasions, what we call as small wounds, and from there it can range even up to major injuries like dislocation of the joint or the fractures of the joint. The usual injuries which we come across, especially in the younger population, are the ligament injuries, and ligament injuries can lead to instability of the joint. Usually the knee and the shoulder are the most common ones which are involved, but apart from that the ankle sprains, the recurrent ankle sprains can also happen to the younger age group. Sports injuries nowadays are on the rise. It's become quite common and we come across a lot of patients with injuries, sports injuries nowadays, but and especially with a lot of people taking to sports, like even the amateur sportsman, the occasional sportsman, who are usually a lot of these IT professionals who go and play on the weekends without much warm up, without much training. They go and play and suddenly they sprain their joints and they can injure their joints. So those are the ones which affect the not the irregular sportsman, but as the level of competition is going higher and higher, as number of matches being played by sports persons are increasing, the sports injuries are also on the rise. And in fact, one of the major reasons is lack of proper physical training. I always tell, and it has to be individualized training. It has to be an individualized training. You cannot give the same kind of physical training to a runner and same kind of physical training to a cricketer. Even in cricket also, the batsman and the bowler, they need different kind of physical training. Same comes the role of physiotherapist also, who keeps assessing these patients and players and making sure that they are injury free. Now, apart from the apart from physical training, the most important thing is to prevent injuries. Apart from the need of preventing injuries, that can prolong the even the playing years of the sportsman. Because nowadays, if a player misses a season, he's going to lose millions of dollars, that kind of thing. So that's the amount of competition also nowadays which is there. So everybody wants to be fit, but again it's a high demand area. Regarding diagnosis, the sports injuries are usually they come to the casualty or the hospital, and then they are first treated by the casualty medical officer. And they are seen and they are sent for X-rays. If good history and physical examination is very important while treating the sports injuries. And usually most of the injuries, if it is fractures or anything, can be diagnosed by X-rays. But the more the complicated ones, that means the ones which have ligament injuries or the injuries to the meniscus, which is the structure in the knee joint, or same way the shoulder injuries, they are usually diagnosed by either ultrasound or MRI scanning. Now, but the first person to see these injuries is the physiotherapist who is on the field. The physiotherapist should be able to assess the patient properly and make sure it's a minor injury or a major injury, and whether the patient or the player needs to be shifted to the hospital. Even shifting to the hospital is also very, very important when such an injury happens, that make sure that no further injury happens to the player. So whenever an injury happens, that area has to be protected well.
So doctor, what are the treatments for the sports injuries?
Now the treatment depends on the type of injury. If it's a simple sprain, say grade 1 sprain or grade 2 sprain, they can be treated by rest ice packs, the injured part should be elevated, kept elevated, and at the same time it should be, sometimes it has to be protected with a splint or a plaster. But before that, I always tell the most important thing is on the sports field, not to aggravate the injury, not the injury should not become worse. So the most important thing is, so a lot of times we come across that the player says that, or even the students in the school, they say that I sprained my ankle and somebody tried to rub it out, massage it. And I think that should not be done. So no massage to the injured area, no heat therapy, and no application of any ointment. These three things have to be important. No massage, no heat therapy, and no application of any rubbing of that area. That area should be, the injured area, if it is an ankle or a knee, it has to be protected, or preferably it should be protected with a bandage, and some ice packs have to be applied. The cold compresses, what we call. Once the patient comes to the hospital, these minor injuries can be treated again, like I said, with the plasters or splints. But the major ones, the major ligament injuries or the fractures, they need surgical treatment. Now, the fractures are usually treated by the trauma surgeon or the orthopedic surgeon, but the ligament injuries or the joint injuries, they have to be treated by a person who is trained only in treating sports injuries. And usually they are the people who are trained in doing arthroscopies. Arthroscopy means keyhole surgery of a joint. So the different type of injuries which happen. And apart from the arthroscopic surgery, the most important thing is the rehabilitation of the patient. That is the physiotherapy and the rehabilitation. And that is, I would say, constitutes almost rest of the 50% of the treatment. Physiotherapy, again, so the rehabilitation of the patient can range from 6 weeks to 3 months, and sometimes after a major surgery it takes up to 6 months for the patient to come back to the sports field.